After a lot of research, dental graduates have now got the opportunity to learn equivalently to the medical graduates. Let me explain you how. Now we'll see about the dental subject and the MBBS subject. So here's it. After a lot of research, dental graduates have now got the opportunity to learn equivalently to the medical graduates. Let me explain you how. See, here is the dental subject called as endodontics, and here is the MBBS subject called as neurologist. Means a degree called as neurologist. Both deal with traumatized patients along with the knowledge of all the internal in-depth connections. For example, the root canal, the innermost structure of the tooth, and pulp, the innermost structure of the root, is respectively present in endodontics. For example, the nervous system, the innermost and the most important for the survival of the body, is studied under the neurology section. Even the root canal and the pulp are required for the vital health of the tooth. Proper functioning of pulp and root canal in tooth, as well as the nervous system, proper functioning in a body, is necessary for a person to be healthy. Next, let us see about the periodontics and orthopedics, which are related. Both the branches of medicine field are concerned with bone marrow and osseous structures. In orthopedics, while the dento-osseous structures in periodontics, so disease, deformities, defects in bone are concerned with these two. Now I want every one of you to know if someone is suffering from bone marrow problems or joint pain or osteoarthritis, that person, according to my research from all evidence-based sources like books, patients, etc., is that this patient is likely to suffer from gingiva-related problems on an occasion. The problems may be gingivitis, periodontitis, periodontal abscess, supragingival plaque, subgingival plaque, bad breath or pyorrhea, etc. Next, let us move forward. The dental subject oral and maxillofacial surgery and the MBBS subject dermatology. Both the oral and dermatologic surgeries require suturing procedures which are done on the skin. Both the oral surgeon and the dermatologist as a surgeon work on the skin. They operate on the skin. The suturing processes are done on face for proper aesthetics by both of the oral and maxillofacial surgeon as well as a dermatologist. Next comes the periodontics and the gynecologist. Both fields have a specialist degree for children. For example, children with anodontia or where all teeth are missing in the oral cavity, birth defect goes to a periodontist. Same way, any birth defect during birth, any kind of complication in the baby's proper body functioning after the birth has to be first looked into by a gynecologist, even before than a pediatrician. Then the patient is sent to the pediatrician. Finally, the least likely to be, but yeah, they are relatable, a gastroenterologist and prosthodontics, where there is use of instruments for analyzing the patient's condition. Like endoscopy is done through passing an endoscopic tube into the esophagus towards the lowest esophageal sphincter, which is relaxed in gastroesophageal reflux disease, which is a specialized field of concern for a gastroenterologist surgeon. While for prosthodontics, same way, the patient is checked with the help of impression trays, crowns and bridges are made. Then a otorhinolaryngologist and orthodontist. Who is a otorhinolaryngologist? Oto means ear, rhino means nose, laryngo means throat, and ENT surgeon, ear, nose, throat surgeon, is a otorhinolaryngologist. Now, similarly, a otorhinolaryngologist is concerned for oto, ear defects, ear machines are available. Same way, for an orthodontist, to correct the teeth defects, braces are available. So, ear defects are corrected by the ear machine. while teeth defects are corrected by the braces-like machine, for the machine called as braces for the defects in teeth. So now you don't have to worry. Both the degrees are equivalent to each other, but you have to choose wisely. All the best to all. Thank you.